Welcome to Lovesick, the podcast where we dive into health, wellness, and relationships and their impact on the world today. Come be a part of the discussion and join our community by following us on YouTube, Instagram, and listening wherever you get your favorite podcast. Enjoy the show.
What's up? Welcome back to the Lovesick podcast. We're back. I love it. I always feel good when we're in the studio. I am your host, Jada, and with me,
Dorothea.
And we're so excited because Dr. Ebonie Vincent-Sleet, she is joining us again. We always love having Dr. Ebonie, so welcome.
I feel like everyone's singing their introduction.
Yeah.
Hello.
Gotta get a new song.
It's great to be back.
Yes, we love you.
We love having you. So, the dreaded word is school is back in session for most, and it's coming back in session again for my kids. Don't want to hear it, but it's coming back. There's going to be a lot of happy parents, but your kids will be in sports. Your kids will be active. I know my kids do karate. There's kids, do dance, all the things. And I think, the biggest thing we don't really discuss is foot health with the youngins.
Right.
So, we're bringing Dr. Ebonie back to give us some advice and what to do and
where to go from here, right?
Let's talk about those kids.
It's always weird when the back to school commercials start rolling around and that's when you start to make your little list of what to get, what's in shopping wise. So shoes definitely play a big, huge role in that, I guess, especially if you're trying to be a fashionista at school to get with the trends and style. For whatever reason, the flatter shoes tend to be the more popular. And sometimes, you trying to be trendy is just going to be at your detriment, So I think we talked a little bit about this on our last time we did a podcast about how it's really beneficial to know what type of foot you have in order to kind of then know what type of shoes you need to be wearing to kind of avoid some of these pitfalls. So putting a flat foot into an already flat shoe, it's just kind of a recipe for disaster, especially for, kids who want to play sports. Okay. So I get a lot of kids who are very athletic with the flattest of feet. And I tell people all the time, you don't have to consider doing a whole forefoot or rear foot reconstruction to make yourself have an arch or anything. Sometimes you just need support, And if you're doing all the right things, at least 70% of the time, that's a passing grade,
Right.
It's a good job.
Yeah.
So, inserts are always a great idea for kids, especially with flat feet. I think Power Step is a good over-the-counter brand that you can start off with. At the very least, getting an insert, and even if you put them in a flatter shoe so you can have at least the support and the aesthetic, is better than just nothing,
Right.
But I do maintain that you should still always have a shoe that marries the insert,
That's good. How do you can you tell our listeners and stuff what to look for in a foot to
Right.
Yeah.
Well, I mean, it's simple to know what kind of foot type you have. Dip your foot into water and walk on a piece of paper and see how much arch is available for you. If you have a whole footprint and you see a little bit of arch there, you would normally have what I would consider a more straight rectus foot type. If you see a whole big arch there, that means you have a flat foot. You're kind of just all over the place. And then if you only see the toes and the heel, then you have a super high arch. So that's a simple way to determine what kind of foot you have. And then when you go shoe shopping, when you go back to school shopping, you kind of know if I want these shoes, I should probably get some inserts, for them. Or if, you want just some regular parameters about what kind of shoe you should be wearing. It's okay if the shoe bends at the toes because that's how we push off and we walk. It's not okay if it bends at the arch. If you can fold your shoe like a pancake, and that means you're absolutely having no arch support whatsoever.
Okay. Now, what about the support? Where, do you have a brand or brands that you recommend for parents to look for their kids? for their art support?
Well, yeah, Power Step. It's over the counter. It's a good insert to put in any type of shoe. But the shoe itself, I always recommend New Balance. They're making a comeback. They're making a comeback in terms of like their popularity and style. Like Coco Golf, I think represents them and stuff like that. So that's a really good thing. I think New Balance, unfortunately, got a bad rap for being an old person shoe at one point.
It is like the old dad shoe.
It's like old,
that happened, but it's like the old.
Right. So when I recommend people New Balance, they're like, I'm like, no. It's really good. Like they're having a great comeback. Like,
what about like the Skechers and stuff? Because I feel like back to school, I always see Skechers.
No, well, I don't want to bash the whole brand. There are great Skechers that you can have, but overall, I just feel that there's better brands out there. A lot of times, I'm okay with Skechers for people who are mostly sedentary, like for the elderly people who maybe take walks to and from the mailbox. You know. If you're gonna be ripping and running,
not the shoe.
It's probably not the shoe for you. You want something a little bit more durable. With like better quality like stuff. Also, when it comes to a quality shoe, you should be able to remove the insert that the shoe comes with to put in a custom insert if necessary, or the over-the-counter Power Steps, like I was saying. Like those are the kinds of things like make up a good quality shoe. Saucony or Saucony, however you want to pronounce it. It's also another really good shoe that has a good aesthetically popular style for the kids these days. But yeah. You've got some of those?
We have, but my son is wearing Vans right now and they're very flat. So
don't get me wrong. I like Vans too. I do, and there are some Vans that have more art supports than others. But yeah, just wear an art support especially if you have a flat foot. Yeah, for sure.
Well, I also think like some kids aren't going to tell you like if their feet hurt after putting shoes on. Or, like, so you never know like, are you getting, is your shoe fitting okay? Is it right? Because sometimes they're just like, I'm fine. Like, and you just never know if their feet hurt.
Yeah.
Especially with the trendy shoes, they may want to wear it and go, I can't.
They'll suffer through it.
They'll
suffer through
it. Like we do with heels though sometimes.
As long as they're in the in crowd with the shoes, they will suffer through it, my first question to kids, usually if their parents bring them in, I'm like, so do you have pain? And they're like, no. I'm like, well, do you find yourself getting tired more than your peers doing stuff? And then they'll be like, well, I am a little slower and like, or I can't play on the playground as long. Like, it's more about like how long can you have fun as opposed to if you're in pain,
Interesting.
So that's the kind of questions that I ask.
I feel like last time we talked, I feel like even myself, I was like, I should go get my feet looked at. But what is a good age to like start kind of?
I mean, as soon as, a lot of parents, if they've had themselves had foot issues, they bring their kid immediately. They're like, they're 2 years old and they're like, what's wrong with my kid's feet? And I'm like, nothing, they're 2. But it's also, a good age to kind of, take survey and then monitor, like what's going on, especially because, when you're a toddler, like most of the time you're mostly going to be barefoot. I know you need to have your sensory sensation just kind of stimulated.
Right.
So you don't want to just put them in an actual like thick-soled shoe because then they'll be, just a little off balance,
I'm sorry. This is it just dawned on me. I'm glad you said that because there's been a controversy about when a toddler should be wearing those hard bottom shoes, the hard bottom shoes.
Yeah.
So maybe you can kind of explain that.
Yeah. So, I mean, I think you're referring to like those hard, like
back
in the day.
Do they still make those?
Yeah, I don't know. But like some parents,
I had to wear those, didn't I?
Yeah.
My sister and I.
Yeah, they may not put that, the kids' feet in those yet, like when they're 1 or 1.5. So what age should they be wearing these type of corrective shoes?
I don't know. I don't know if it's the answer is never. Because those really are hard soles. Like I've seen a lot of parents or adults now who come in and said that, all of my foot pain started when I was wearing these shoes. You know what I mean? Like, because there's a lot of there's a lot to say about the rigidity of the shoe and like lack of flexibility. Like sometimes that's necessary if you have an actual foot condition that requires like bracing, right?
Okay.
Like if you have a club foot deformity and like you need to be casted, or if you have had, what's called Ponseti casting, like they do Ponseti casting right out of the womb to straighten out your foot. Oh. And then if that's your condition, they might suggest actual shoes and braces. So that's a totally different story than you just thinking, oh, how cute are these shoes? Let's put you in them.
Right.
Largely like your toddler should be barefoot or very low, like minimal kind of sole to maintain some flexibility because they're still developing, If you're worried about a flat foot, like in a 2, 3, 4-year-old, they do have inserts for kids that are a little bit, they're not as rigid as the ones that I'm recommending for adults or older school age kids. They're more soft, so that way they can have some level of support, but like mild correction. Okay. So you can find, there's different levels to it, and it all really depends on your condition.
Wow. Yeah. What about the children that are athletes,
Yeah.
Let's talk about their feet.
Let's talk about it.
And does it vary in your age? Like, if you're a 7-year-old athlete versus like a 13-year-old athlete.
Right. It's always tough because it depends on the activity. So you definitely have to cater to each person's activity. So for instance, you might not just be playing basketball or football. You could be doing jujitsu or karate or gymnastics or things of that nature, ballet even. So you have to take into consideration that these kids are still growing. Like if you were to take an x-ray of a child's foot and compare it to an adult's foot, a lot of people look at a child's foot and they're like, oh my gosh, there's fractures everywhere. But there's not. Those are growth plates. Growth plates are everywhere in a kid's foot. And so you can't stunt the growth plates. Like for instance, for ballet, if you are trying to be a competitive ballet person and you're going to be on point, or gymnastics, you're constantly pounding on those joints.
Right.
You just have to be cognizant of your kid's pain scale and the consistency in which they're pounding on these little tiny joints. If that's your sport, when you have to be barefoot most of the time, I highly suggest you make good choices when you're not in practice. So you wearing flat shoes, no arches, high heels all the time, and then you go and do your sports that's pounding on your little tiny joints, it's just not a good idea. Okay. So, that's why I'm saying if you do right 70% of the time, it can at least get you to a place where you're good, right? Yeah. It's quite different for football track stars, they're in cleats. There's really not a great option for inserts to put in a cleat because it's just so narrow. I haven't found one, but I do suggest they try like a half-length orthotic as opposed to like a full-length one.
Right.
Because you can probably get by with having that hind foot corrected.
Especially sometimes they play like,
their
practices are
all the time.
Rough too. And that's a lot of hours on the feet.
Exactly. Yeah. Lots of hours on the feet.
What about soccer and stuff?
Soccer, same thing. Yeah. Cleats. Yeah.
Yeah.
Mm-hmm.
Wow, that sounds like a new invention.
I was going to say, better come up with
Dr. Ebonie, I think you may want to resurface that.
Redo the whole I'm going to figure this out. I know.
Yeah. No one is doing this right now, so that could be something that you can look into.
Exactly. I feel like a lot of times, like the athletic shoe companies have kind of cornered the market and made it athletic and made it look cool. But sometimes it's like, it's cool for athletes who have no problems, but it's not cool for you. You've got different feet.
Yeah.
So you might want to consider, alternative.
I wonder if that's like, if you're a ballet dancer and you have flat feet, could you really do ballet? Or if you have, you know what I mean? Like certain.
Sometimes a foot deformity will help you with your sports though too. Like, if you see ballet dancers, they're always like, like that.
Yeah.
Have like hypermobility. That might actually be better for you. You might have good feet.
Good feet.
You might have good feet for ballet,
I have a question. Does weather or seasons, can they affect like feet?
Ooh, that's a good question.
Issues or feet? Like, because we're coming off of summer.
Yes.
And, a lot of people are at the pool and they're outside or they're barefoot or whatever. And then, I don't know, like, can you go into winter and your feet are I don't know. Like, is there something that can change it?
You're spot on. Like, especially during the summer months and leading up to the summer months, people develop fungus like crazy. Like fungus, it doesn't take much. If you have a hot, warm, sweaty environment that you always are putting your feet in or anything like that, soap and water doesn't cut it because that's an antibacterial. Which leads us into how to combat fungus.
Yes. Yeah. Maybe talk about this for sure. Yes.
Right. So this product is Smooth Antifungal. The AF stands for antifungal.
Right.
Okay. Oh, and it's alcohol free.
I was thinking of something else.
It's a play on words, but definitely
that's
exactly.
I was
use it for what you may, but okay.
Right.
Okay, that's right.
At any age, this is great, but also really, really great for kids because, first of all, it doesn't have any alcohol in it, which alcohol dries out your feet a lot. Okay. And when you have athlete's foot, it looks itchy, redness, dry. It looks dry. Most people, when they come in, they don't even realize they have athlete's foot. What they do see is like a dryness pattern around both of their feet, and they think it's like just dry. And then what they do is they add lotion, which makes it worse because excessive moisture makes the fungus worse. Okay. And so these smooth wipes, they're antifungal, and you can give them a wipe. It has tolnaftate in it, which is really good antifungal medication. But it also has all natural like eucalyptus oil, menthol, like to make it really like feel good. It's like a cooling aspect of it. And it also has natural moisturizers in it that don't affect or contribute to the fungus. So it actually restores your skin too. So I use this all the time on my toddler. Right. Because she's so like barefoot all the time and she always wants to go outside.
That's a good product to have.
I thought about that when they were at camp.
Put it in all your bags, your gym bags, because the amount of people picking things up in at their athletic events, at the gyms, and stuff like saunas, nail salons, like all the things. Like this is like the perfect product for all of that. And then just give your skin a wipe down, and then you can actually wipe the insides of your Crocs, insides of your sandals, because it will kill the fungus there too. Because the reoccurrence rate for fungus is super high. So.
Is that like preventative kind of thing?
So this one comes in a pack of 14. And then there's another 30 pack that you can get online. They're sold on Amazon. Okay. Only online. You can either get them at their website, smoothantifungal.com, or just getsmoothaf.com. Right. Or you can just search for Smooth AF wipes on Amazon and they can get to you.
Are they expensive?
They're $16.99. Okay. For the pack of 30.
Oh, that's not bad.
It's doable.
That is do you do them preventative? Like, is it like something where like before?
Yeah. I mean, you can feel it. I'm going to open it up for you so you can see like this little package. It keeps it nice and moist.
Oh, yeah.
But it smells good too. I don't know if you want to smell it and like take a look at it.
Yeah.
Yeah.
Ooh.
Yeah. It's kind of luxurious. I do it all the time.
Like mint or like
you can like rub it on your hands.
Eucalyptus, right?
Okay.
It smells good.
Yeah. Well, are you going to pass it?
No.
Just like after I use it all, would you like to have some?
You can like give it a squeeze after.
Oh, that smells really good. Actually.
Yeah, it smells good, and like you can feel how it's like it's medicated, but it has moisturizing. And it feels like
it just opened up my nostrils. That is really a nice smell.
Yeah, I think it's a really good like multi-use or multi-purpose kind of towelette. Yeah, you can use it for jock itch as well. It's kind of a whole body thing. I'm a podiatrist, so I'm mostly saying use it on your feet. Right. But it's everywhere. Like I feel like nursing homes could use it.
Oh, definitely.
Because not everybody showers every single day. But like
I wonder if preschools could use it because they have kids out in or at least a parent of a preschooler maybe.
Well, no,
because preschools probably can't use it.
Yeah, definitely.
But to good to know even because you think about those summer shoes like my daughter, we all have like natives and Crocs, and we've just been throwing them on all the time.
Your foot back in the Crocs. Yeah. You wind up with a nail fungus and you'd be confused.
Yep.
It's just like there's ways to prevent it.
Right.
And I feel like what's on the market now, it's mostly like lots of alcohol. Like I know
it is.
Like Lotrimin or Tinactin, like those are the name brands like normally people go to.
Right.
Okay. And it's usually like a spray,
Yeah.
And most of the spray I feel like it's everywhere else except for
Wow.
But yeah, even like the alcohol is so drying that it's like, okay, am I dry because of the fungus now, or am I just dry because of the alcohol? And now what do I do? Do I put more lotion on? Yeah. It's confusing. I feel like the wipes just kind of take the kind of confusion away. Just give yourself a wipe. It'll air dry, and
that's good to know.
You'll be antifungal.
Yeah.
You know what I mean? So. But to wrap a bow on your question, yes, fungus can definitely happen more so in the hotter months. In the cooler months, it can still happen because you're just insulated all the time. Like you're always wearing shoes and socks. And like if you just happen to have sweaty feet, you could still have a fungus. But I feel like the winter months mostly affects the older population. Like you definitely will tell like arthritis is worse in the winter. I know, personally, I've had knee surgery, so I can tell if it's about to rain based off the pressure in the atmosphere. I'm like, I think it's going to rain tomorrow.
Really true then, huh? When they say, I can tell because I can tell because of my aches.
Yes, you can tell. Like it's the truth. So most of the time, I feel like the diagnosis that I am seeing, it is based off of the seasons.
Yeah. I mean, I can see that. That's what people say sometimes with their hands when they're like, my arthritis is
kicking in. Yeah. That's true.
What about like pregnant women and stuff like that? Like
getting ready to ask her that. Yes.
I mean, when I was pregnant, I was not wearing heels. I may have wore boots sometimes, but like, I was just not feeling any of that stuff. So curious.
Yeah. Well, I can tell you firsthand as a pregnant woman now.
Yes. Congratulations. Yeah.
So excited.
Second time around, y'all. So if you followed her the first time, you would know this is the second time around.
Yes. So I got lucky, I feel like, with my pregnancy and feet, but definitely there are things that pregnant women can look forward to if that's what you want.
Oh goodness.
Term, I don't expect. Not look forward. You don't look forward to this, but you can expect. Yeah, exactly.
Right.
So your feet will swell. Like you're gonna gain weight, and like gravity's not your friend. And your feet are gonna swell, and with that, you can have varicose veins. I always recommend compression socks for pregnant women, just to make sure that you're fighting gravity as best you can and pushing the blood flow back to where it needs to go. So compression socks are going to be your friend. With pregnancy, you need to have all your ligaments relax for you to push the baby on out, which is not doesn't limit you to just your reproductive ligaments. It's also on your feet. So when pregnant women are like, oh my gosh, my feet are flatter, or they gained a size, that's true. Like you really can have a flatter, bigger foot after pregnancy, and it could stay that way. It doesn't really necessarily reverse, Thankfully, I didn't have that. I was like, oh, still fitting my shoes.
Wow.
Still got it, But
think about that.
No, I mean those things that you're telling them a lot, because those things you don't think about.
You don't think about it.
You only think about the baby, the belly, everything. Yeah.
And I know people try to still look cute in their heels. I still was wearing, cutesy shoes when I was trying to do my maternity shoot and my maternity this and that, the third. But at some point, just wear flats with good support. At some point, you just have to you support your body. Because then like your sciatica starts hurting, like your back.
Oh goodness!
You just really want to. As you can tell, I'm like going through it. Like, oh
my gosh!
I know. I was going to say, Dr. Ebony, are you talking about for the viewers, or are you talking about for yourself?
Hey, personal experience. You gotta
but experience tells it all.
Exactly. I know. But I mean, after your body recovers, like largely, I do feel like it comes back around. But what may not come back around is like the feet. Unfortunately. It surprises me all the time, like when pregnant women or postpartum women come in and they have all these new things with their feet. They're like, my ankles hurt. I have ingrown toenails now. I don't know where this came from.
Yeah. And everything basically
everything
changes.
Yeah. Mm-hmm.
Oh man.
Mm-hmm. Jeez, you don't think about that though,
Yeah.
Especially you know what it is? You don't think about how important your feet really are.
No one does until it's painful.
Until something happens. Like sometimes we're not good to our feet.
Yeah.
I know.
Yeah.
It's true.
We're not good to our feet.
It's true.
Kind of beat them up until they no longer
we
work.
basically take it for granted. That's what happens. We take it for granted.
But can the wrong support like give you like back pain or give you other kind of issues and stuff? Because
if your feet aren't correctly supported, it could definitely mess with your knees and then your hips. Like it's a whole biomechanic process that definitely starts with your feet.
Okay.
So you definitely have to be cognizant of it all.
I know. I mean, you don't think about it. Like, your feet are pretty much in control.
But then you overthink about it.
Right.
Get away with the shoe for 5 minutes. I don't know.
It's such a bargaining process when I talk to people about their shoe choices. Like I've had patients bring like bags of shoes. Like, are these good? Are these good? And I'm like, keep these, take those, keep these.
Wow. Oh my gosh.
I know. It's so interesting. And even for men though, too, you wouldn't think about it, but men's shoes, especially men's dress shoes, they need probably a revamp too. Like, the amount of me trying to bargain men off of a Nike or a Kohan, it's just there's not a lot of
Jordans.
right.
There's
not a lot of options.
Put some of your Jordan collection away, you guys.
Come on,
good for your feet.
Some of your feet just do not fit into a Jordan. They just don't. Like my husband's a sneakerhead. He's got a really bad shoe fetish. Worse than I guess he married a podiatrist for that reason.
That's why it worked out.
Right. I don't know what's going on. He's like has all these shoes, and I'm like, oh my goodness. And of course, this makes sense for us. Anyways.
Hey, well, let's talk about these men.
Yeah,
but I am curious about the men though.
Let's talk about the men.
It's true. My husband has the perfect foot type for a Jordan, but he's a very narrow foot type. Mm-hmm. And so when I see other people coming in and their feet are flat and they're wide and they're trying to shove themselves into Nikes and Jordans, and I'm just like, I hate to break it to you, but if you are that person with a wall full of Jordans, you will have to retire them for the time being, because they're largely probably the reason why you have foot pain, because they're just not going to make them for your foot type,
Yeah.
I think it's an ego thing though sometimes.
It is.
It's definitely
take your advice sometimes.
It's a culture.
Yeah.
I wasn't a sneakerhead or anything, but I guess now I am by proxy,
Right.
But it's a whole culture conversation where, like, I don't know, my husband will be walking around and he'll be like, see what he has got on? I was like, no, I don't. I don't. And he'll know exactly like when it came, what year it came out, why. It's like a whole history behind the shoe. And I'm just like, well, is he, hoping that people like you will come up and say, man, I love your shoes. And it's true. They talk to each other. They're like, hey man, I like your shoes.
Yeah.
And then you come in there and you're like, but how's your foot feeling?
However,
let me tell you,
they look good.
I come in just with a bad news. They don't see me coming.
You have a whole rack of those tennis shoes, and you'll be coming back to see me with these.
I don't get me wrong. I love Nike as a brand. I think they work well for some people, but some people just, it's not for you.
Yeah.
And it's unfortunate, but that's why you're in the business that you're in. People need to learn.
Yeah, no, it's true.
They need to learn about how, it affects their health, really.
Right.
It's so many things different parts of your body that affect another part of your body if you don't treat it right. And it's like, sometimes you don't think about, even for like dental stuff, people don't realize how much it does affect you if you let it go. And so I feel like it's the same.
Even in your feet, especially in the professional setting, they take a huge beating, because oftentimes shoes that would be considered appropriate for you are not considered professional. And so the amount of times I'm writing notes like, hey, patient must wear this type of shoe because their job requires them to wear a different type of shoe is a lot, more so than you would think.
Yeah, that's true too.
That is true.
So it's like you have to have a work note to excuse you for not dressing up to code or something.
That's nice.
Yeah. It's crazy.
Interesting.
I mean, it is interesting because you mentioned before, and it's funny because the older that I get, I definitely think about the different types of shoes. And you mentioned Cole Haan, and I have
some.
I have the shoe, but it's more of a wedge.
Yeah.
Yeah.
I mean, it's not like the most dressy
No,
of the shoes,
no.
but
It's a
casual
wedge dress.
Exactly.
Like casual dress wedge.
Mm-hmm.
But it's comfy, you know.
Yeah.
It's very comfortable. But yeah, I can't wear like stilettos and that kind of stuff. Like back in the day, I could wear all those type of things, but now I can't even walk in those type of shoes. Yeah.
I mean, thankfully, there's brands out there now that are podiatry approved.
Right.
Like, you know,
like heels and stuff.
Yeah, she
Heels
said that the last time.
Oh, that's
Yeah.
right.
Yeah.
Tell
Let's
us
talk
again.
about it.
Yeah,
but
no, I mean, Ali footwear is a good one. Vionic, VIO, like not Bionic, but Vionic is a good one. I love Fit Flops or Power Step sandals and house shoes because, especially during COVID, everyone just stopped, you know, caring and walking around barefoot in their homes.
That's true.
True.
And it's like, you know, that's when problems happen because you're not supporting your feet.
Right.
But you can wear a slip-on slide house shoe that has support, and you can walk around without, you know, causing yourself harm.
That's good to know.
Yeah.
So
because we walk around our house
all the time with no shoes, socks, exactly.
Yeah.
But, you know, a couple trips up and down the stairs or to the kitchen, to the mailbox, all that stuff barefoot, it adds up to miles, you know, and it's just like. I wonder why my feet hurt now. Like, what do you think?
Yeah, I can definitely.
You walk around barefoot all the time. No, but I see
exactly.
I didn't know they made like flip flops, I mean, like house shoes like that.
Yeah, they make. I mean, well, you know,
or you turn them into house shoes.
No, you do. They actually have a built-in insert in the house shoes, like they're fuzzy and they're fun.
Oh,
yeah, I have a pair. It's like great.
Oh wow! Well, can you tell us the name of it?
Powerstep.com.
Okay.
They're not paying me to say this. I just recommend these to you.
Yeah, all these are recommendations.
Yeah.
Just so everybody knows.
Recommendations.
Recommendations. Obviously, you check with your.
Paid to mention your shoes.
Yeah.
But you can call her if you want.
Yeah, you can call Dr. Ebony or check with your other provider. But yes, we are just.
No, these are good, simple things that any podiatrist will recommend for you.
I love that.
You know?
Especially New Balance. You better call Dr. Ebony New Balance.
Yes, New Balance.
I have been looking at some of those New Balances. Not gonna lie, they are looking kind of cute. I'm not
They're
gonna-
cute.
Yeah, they are.
Yeah,
They've
very
been making
cute.
some like really cute ones, so we'll see. But
Yeah. Technology. Technology is something.
no, I'm all about the no. I think now I've like my mom was saying, I'm reached a point too where I'm kind of like I go out for style, but like I barely even still go out. A lot of times I'm wearing Crocs. So.
Yeah. I mean,
So
just
bad.
wearing like a shoe to go out and hang out, but then before you're out, you're like taking the shoes off. You know what I mean?
Right.
I can't even wear heels anymore.
Yeah,
I
it's
tried.
hard.
I think we talked about this last time.
Yeah.
It's just they didn't look cute
No.
on me.
Now, what about, Dr. Ebony, what about people that have diabetes? And like I know that people come to you about having diabetic problems with their feet.
Yeah. So the biggest concern with diabetes in your feet is nerve issues, like the neuropathy. You're not able to feel your feet. Like the sensation is just gone. Sometimes you actually have pain with the neuropathy, like sharp shooting sensations or tingling or burning pains. That's something that can be controlled with topical or oral medications, like the pain side. But if you have straight numbness, it's kind of a concern because it's like you have to look at your foot to see if there's something wrong with it. And a lot of times diabetics are just walking around with no idea that they may have stepped on a needle or they've scraped the bottom of their foot. And then all of a sudden when their foot blows up or is red, hot, and swollen, that's when they're like, maybe I should go check this out. And then you look at the bottom of their foot and it's a big old hole, like a whole ulcer, you know?
My gosh. And that's because they couldn't feel it though, right?
Right, because they couldn't feel anything.
Ooh.
And so if as a diabetic or newly diagnosed diabetic patient, there's two doctors you absolutely need to establish yourself with. One is the eye doctor and one is the podiatrist.
Right.
Because the nerves that are affected first and most often are the ones in your eyes and the ones in your foot, which I think it's unfortunate because like you can't feel what's going on with your feet and then you can't even see it. So.
Oh, yeah, I didn't even think about that.
Wow.
Oh,
So
my God.
it's kind of messed up. So,
Yeah.
you have to get yourself established, even though you might feel like nothing's wrong. You might feel like I'm fine. I have no pain or anything, but you at least want to have a number to call,
Yeah.
a landing spot to be like, okay, if I don't see you but once every 4 to 6 months, at least I have an appointment or at least I have a number. You know what I mean? Because I can't tell you the number of times where I'm meeting someone for the first time and we're having really sad conversations. Like, how long have you had this wound? What wound? This one right here. Like, and now we got to get MRIs and I detect infection in your bone. And then that's not a great conversation to have because now we're talking amputation. And it's like this person that just walked into your room is now telling you that your toe is going to get cut off. You know what I mean? That's not a great introduction.
Right.
Now, do you recommend diabetics come see you more, like, get their feet?
My first conversation with diabetic patients, even if they're well-controlled diabetic patients, I tell them I want to see you at least every 6 months. For the ones who are more at risk, I want to see you every 2 to 3 months. You know, it's not a large visit, but I'd rather see you here than meet you in the hospital. Yeah, I'm sure you'd prefer that too.
Yes,
especially because of the different changes. If something happens within the 3 months or the 6 months that you're actually seeing them,
exactly,
so you can catch anything hopefully in time.
And prevention is the best form of healthcare, I believe, because let's say you are active, you're diabetic, but you have neuropathy and you're active. You could develop a callus. Most people have calluses when they have exercise and like pressure points and stuff like that. But if the callus gets too thick and no one's debriding it or you're not like trying to take care of it, it can turn into a wound very easily. So every 3 months, if I'm shaving your callus, it's just a callus that I'm shaving.
Right.
Not a wound, you know, that could turn into infection. So diabetes is a serious systemic overall attack on your body, you know? And like you have to have help to regulate what's going on. Otherwise, it is very hard to heal from wounds, you know? And I love an informed patient, but we can't do it all by ourselves. You know, I think a lot of patients these days are very smart and like they research and Google and do all the things. But you have to have a medical team behind you so you can get your resources intact, you know? And I think that's the biggest thing when it comes to the medicine behind diabetes. Like, you've got to have a medical team. Otherwise, if something happens, you're protected, as opposed to, well, who do I go see for?
Right.
You know?
Right.
Where do I go? Like,
Google. Just kidding. TikTok told me that.
And too many people go to social media for medical advice. And, and they're not, the social media platforms are not doctors. I mean, there may be some physicians that's on there, but you know what I mean about some people using
I know
that.
what you mean.
I was going to say, you probably get a lot of...
There's a lot of Facebook groups, TikToks, and all this stuff that I feel kind of falsely empower people to know what to think, like, I know what I have. I have this and I need you to do that. And I'm like, you actually don't have You know what I mean? Like, we have to kind of walk it back a little bit and be able to like guide you to a point where it is safe for you to go and look at Reddit or somewhere. You know what I mean? Just so you have the right diagnosis. Because I think sometimes people can really, really jack themselves up with that.
I mean, I will say I am the person sometimes, not informing my doctor what I have. I don't do that. But sometimes there'll be those 3 a.m. scrolls where I'm like, oh my God, but yesterday I was feeling this. So now I got it, but I'll call. But I won't be like,
I think everybody's
guilty of that. But I'm not going to come to you and be like, no, I was looking up my symptoms and then this is like what I have.
I know. It's tough. It's tough as, you know, as a surgeon too. Like, because I know a lot of companies will do their own marketing and target a certain demographic. And so, you know, you're coming in to see me about a specific thing that you feel as though you definitely absolutely want and need, you know? And I'm like, have you tried this? I don't want that. Oh, okay. You know, you know what I'm saying?
Yeah.
And then when I give my anecdotal opinion, like, okay, well, I've done this procedure a number of times. Like, what they're saying could be true, but you also might fall into these outlying, you know, things. So we have to do our homework and see if you actually qualify for it. You know what I mean? And I feel like some people come in and they don't get quite the answer that they want. And so it's like an immediate, I'm frustrated. That doctor wouldn't give me what I wanted.
Or sometimes it's even like a close family member or friend who may have had the same thing. And they're like, well, no, I didn't need that. Or I needed this, blah, blah, blah. You should tell them that. You know, like, I don't know. It's just everybody...
That's why I like to cater to like the specific patient. Like, you know, I tell everyone, like, they're saying that this procedure is pain-free. I was like, I think you should not believe that.
Yeah.
Like I feel like you should maybe think about the worst thing that could happen and determine if it's better for you to take a chance with that, as opposed to, weigh your risks and benefits.
Yeah. Weigh your risks and benefits.
You get a lot of self-diagnosed, patients that says, well, I looked this up and it says that I have this. So is that true?
Yeah. And I'm happy to have that conversation because I would do the same thing. Like I'm like you.
Yeah.
Like if I don't know what's going on, I'm going to be like, I think I have this. I have that. I'm happy to have that conversation. Like if you tell me what you think, because like you know your body better than me at this point. I just met you.
Yeah.
So let's talk about it. And maybe that'll help me give a clue as to what the bottom line is or what's really going on. And hey, you might be right, but at the same time, I have to ask the questions. We have to do the homework in the back behind it.
Before we get to that, internet diagnosis, let's talk first. Could be, but also
right, because this is not a convenience store. You get surgery,
but also a 3 a.m. surge could be way different than like a 9 o'clock in the morning surge after you've like gone out. You know what I mean?
Or if I can tell you some things that you can further research, and then you can be like, oh, right.
I mean, it is good to research and, check the research sources. But, I mean, everybody, I think, goes online and they just start looking up things. And, I think that's just normal, like natural.
We have it at our access.
GPT.
Oh, yeah, ChatGPT.
That's a whole
Everybody's using that for doctors and therapists and.
I'll put it out there. I love ChatGPT, but it is flawed. You have to train your ChatGPT to have discernment, and that is hard to do. Yeah. If you give it so much information, like only this much information, it's going to be like on your side,
Yeah, of course.
Right.
Yeah, girl, you go. That's fine. You're right. It's your ChatGPT's your hype person.
Right, it's your hype person. And you're like, no, you need an impartial,
Oh my gosh.
Oh my goodness.
It is the truth. It's just like your homegirl or your homeboy. It's like egging you on.
That's
technology. That's all I can say.
That's a whole nother topic.
Another show.
But I wanted to, as we wrap things up, I wanted to just obviously we always love when you come.
Oh yeah.
We love you. We always learn a lot when Dr. Ebonie is here. But if there's any advice that you can give us, like a general, I know we've talked about everything, but just going into the fall, going into the winter, like things are changing, and just kind of give us,
I would say prevention is the best. If you're concerned about anything with your foot or any other body part for that matter, go to your doctor. It's great to research, but go to your doctor, get an evaluation. I would say shop for good supportive shoes. If you're going back to school shopping, that's for all the moms with kids out there. Definitely make good choices.
Yeah. Noted.
Right.
Noted.
And then pretty much like don't wait till last minute. Don't think your pain is just gonna go away. I would say like as soon as you feel as though like something might be wrong, just follow your gut and just make the appointment.
Yeah.
What
about insurances before we wrap it up? Like, do you take all types of insurances for
most insurances we do take. We always have verification before you come in. So definitely call the office and then, let us know. We take cash patients too, So if you need us, we're here.
Awesome. Yeah. I love it.
That is good.
Get them feet checked. Well, as we wrap up, just want to thank Dr. Ebonie and obviously Dorothea, and I'm here, and we love when you join us on Lovesick podcast, and we love the viewers and the listeners, and just everyone just check us out and check out Dr. Ebonie too.
Thank you guys so much for having me.
Check her out. Yeah.
Thank you so much.
Okay. Thanks for watching. Bye. Until next time.